tell us, please, what you're seeing at Callan Lord in terms of monkeypox cases.
First of all, thank you so much for having me on to talk about monkeypox, or as we call it, MPV, or monkeypox virus. We saw our first case at Callan Lord, our first confirmed case of MPV back on June 3rd. And in the subsequent weeks, we've seen an exponential increase in patients coming in, both for testing and confirmed positive cases. Our numbers of confirmed positive cases are now in the triple digits across the country. As far as the latest data that we have from the CDC, we've got about 3,500 cases across the United States, the most in the world. And New York State accounts for about a third of those cases. And so at Callan Lord, if we're in the triple digits, you can see that we are seeing a huge percentage of cases across the country, and are really inundated with demand for services far outreaching what we have capacity.
Well, that's a depressing statement right there. When I have to admit that when I first heard about this, we were told, it's not fatal except in rare cases. It's something you get over in a couple of weeks. Is this really such a big deal? But it seems to be getting scarier and scarier. First of all, you don't know about mutations and where it might be going. But tell us about how people are presenting. Are they having mild effects, more severe effects? What are your patients experiencing?
So certainly there are cases that are relatively mild, but still can be very traumatic. I always bring up the example of a patient that must quarantine. Even if the rash or lesions are relatively mild, we still are recommending quarantine until the resolution of those lesions. And many people are not able to take 2 to 3 weeks off of work. It impacts not only income, but housing security. And so we're seeing a lot of that impacting patients. But also importantly, a lot of our patients are experiencing very severe symptoms, lesions that can lead to tissue damage, scarring, difficulty with eating and drinking or using the restroom. I mean, this, to give an example, only the most severe patients, the most severe outcomes are recommended for tecovirimat or TPOXX, antiretroviral treatment. And so at Callan Lord, we currently have approximately 80 patients that were severe enough and met the guidance to be recommended for TPOXX treatment, just to give a sense of the volume of patients that are experiencing severe infections of MPV. And so, also, I will mention that TPOXX is an experimental medication. It's only been provisionally approved by the FDA for the treatment of MPV. And so every patient that is deemed appropriate, so these are patients in a lot of pain with very severe symptoms, have to go through a really arduous process to access TPOXX. And so that's one of the areas of advocacy that we are really promoting, and that is the emergency use authorization of TPOXX for the treatment of MPV, so we can expedite this process for patients that are most in need. I will also say across the country, about 10% approximately of patients that have tested positive for MPV are severe enough to be deemed appropriate for TPOXX treatment, and about 40% of those patients are living with HIV. And so this is disproportionately impacting largely impacting patients that are living with HIV, which is another population of patients that we serve at Callan Lord. And so it's a bit of a concern to us that this medication is so difficult to obtain right now.
Do people with HIV now I assume that's some coincidence of just where HIV is colliding with where MPV is showing up, but are there specific reasons people with HIV might be vulnerable to MPV or have particular outcomes with MPV?
Well, certainly any immunosuppression is going to make someone more vulnerable to these types of outbreaks, but there is still much research to be done related to the specific outcomes for patients based on chronic disease history. But certainly I also think, this kind of lends itself to discussions around whether this is something that is like solely impacting the LGBTQ community or the population at large, and where to focus resources and education. And, to your point, these outbreaks always start with social circles, right? And so it is less about sexual orientation or gender identity. Viruses do not discriminate to specific populations. Everyone is at risk. And so, when I hear these debates around how to focus outreach and education, I really don't feel that it's an either or, but rather a both and. I think that we need to target resources toward the population that is being most impacted right now, yet everyone is at risk. And so we need to ensure a public health campaign provides information so that everyone can be as safe as possible.